count, we do not have quorum. Is that correct, Ms. McLean?
You need one more member.
One more member. Okay. So I am going to bypass the second and third items on the agenda until we have a quorum to vote on those items. If is that appropriate, Attorney Wardell?
Fine.
Okay, very good. So I'll open the floor to any public comments. Do we have any submissions, Ms. McLean?
No, sir.
No submissions. Okay. Well, Director Jenkins, if you have any staff or program recognitions, I'll give you the floor at this time.
Thank you, Mr. Chair, and good evening to this great board. I have three things for your consideration. First of which, I'd definitely like to laud and applaud and commend our firearms injury prevention partnership. As you may have heard in the news, we're doing a whole lot around NC Safe Week of Action. NC Safe is an acronym standing for Storing All Firearms Effectively. I started off on Monday with an event at the Executive Mansion, which I was fortunate to represent Durham at. And then on Tuesday, we had sort of a press conference and an activity in front of the courthouse in which we were able to really work with the district attorney, Santana DeBerry, and a lot of media coverage, and our gun safety team, now known as the FIPP, were there giving out gun locks. Certainly proud of the work that they've done since 1999. We've given out about 30,000 gun locks, and we have helped and assisted 13 different counties in the state of North Carolina with establishing their gun safety teams. So I definitely wanted to lift that up during this week of action for NC Safe, and just really let the listening audience know that, again, we want you to be responsible gun owners and lock it up. If you have it in your vehicle, please lock your vehicles. But nothing's more important than to protect children from injury and gun violence. Second thing, Mr. Chair and Board, I definitely want to welcome for her first official Board of Health meeting, Ms. Rachel Elledge. She is our new nutrition director. The retirement of Michelle Easterling afforded Rachel the opportunity to present herself for consideration, and she was the choice. Rachel is no stranger to our agency, having been here for quite some time. She is a grown woman, so we certainly want to give her an opportunity to speak to this great board. Rachel?
Good evening. Thank you, Rod. I'm super excited to be here in this spot. I've been with Durham County for 15 years, started work as doing home visits as a nutritionist, doing home visits in Durham County. For that, I was with Wake County, but I'm super excited to be in this spot, and looking forward to working with you guys. Thank you.
Thank you so much, Rachel. Again, we're glad to have you on the leadership team, and big shoes to fill, of course. Michelle Easterling is a legend within her own right, but we know we made the right choice. And finally, Mr. Chair, I would be remiss if I did not recognize our outgoing, soon to be outgoing, Director of Nursing, Hattie Wood, who has tendered her notice of retirement. So
Wow.
This would be her last Board of Health meeting. But how could I not recognize 42 years of nursing service and 25 years of dedicated service to Durham, which is her home county. So again, we are grateful for all that Hattie Wood has contributed to the Durham community. Again, I want to give her an opportunity to speak to this great board if she's able to, but Hattie, the floor is yours.
Oh, good evening to the board. Thank you, Director Jenkins, for allowing me in this space. I'd like to say that I have found my career in public health to be quite quite rewarding. I came here over 25 years ago, hoping to make a difference in the population that I serve in my community. And I was fully vested in what my endeavors were. I never once did I think that I would rise to the ranks of being the director of nursing here in Durham County Department of Public Health. I want to say thank you to the board for always being aware and kind of keeping me on my toes too as to what I need to identify and work on and the challenges that we need to meet in the community. And again, I humbly submitted my retirement, but after almost 43 years of being a registered nurse and having served 25 years of them here, I felt like it was time for me to move on to the next leg of my journey of my life. So thank you for the wonderful opportunity. I truly appreciate it.
Thank you so much, Hattie. And Mr. Chair, the floor is yours. And like I said, I would be remiss if I did not give these great people an opportunity to speak before this great board.
Absolutely. Thank you, Director Jenkins. Attorney Wardell, did I see your hand go up?
You did. You did.
Yes, sir. Go ahead.
I have to say that that news about Hattie Wood is incredible to me. She is the consummate professional. I've dealt with lots of directors of departments, and Hattie has always been at the top of the list. If I need something and I ask Hattie Wood for it, Hattie Wood's gonna get it. And Hattie Woods is gonna get to the bottom of the problem if there's a problem. She will be missed by Durham County. Godspeed. She is a very, very, very important person, and the health department is losing a very, very big piece of what they do now that Hattie is gone. But she definitely deserves it.
Yep.
She definitely deserves it. So good job, Hattie. Well done.
Yeah, absolutely.
Excellent. Excellent. Thank you, Attorney Wardell. And would anyone else like to make comments in regard, in the way of staff recognitions? Well, I want to officially congratulate both Ms. Rutledge and Ms. Wood on their respective new beginnings. And again, thank you, Ms. Wood, for your tireless efforts over the years with the Durham County Board of Health or Health Department. So thank you so much. All right. So I think we still need one more to have quorum, one more board member present.
Yes, sir.
So we will proceed. We're one shy of that. So we will proceed with the administrative reports and presentations. Did we just have someone join us?
Dr. Miller?
Ah, okay. Did Dr. Miller join? If he's here, then we're good. There he is. All right. So let's go back before we go to the administrative reports and presentations. Let's entertain any additions or corrections to the printed agenda. Any additions or corrections? All right, I will accept a motion to approve the agenda as presented.
So moved.
Second.
All right, it's been moved and properly seconded. If there's no debate, we are ready for the vote.
Dr.
Ms.
McDougall,
McClellan. Yes, ma'am.
Commissioner Alam, Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Braithwaite,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
and Dr. Glover. Thank you.
All right. So we'll go on to the third item on the agenda, which is review of the minutes from the previous meeting. Hopefully everyone has had an opportunity to look over those minutes. So at this time, I will entertain a motion to, well, are there any additions or corrections there? If there are none, I will entertain a motion to receive or to approve the minutes from the
So
May
moved.
meeting. All right.
So
We have a
moved.
we have a motion on the floor to accept the minutes from the May meeting. Do we have a second?
Second.
All right, it's been moved and properly seconded. If there's no unreadiness, we are ready for the vote, Mrs. McLean.
Dr. McDougall,
Yes.
Commissioner Alam, Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Brightway,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
and Dr. Miller. Oh, excuse me, Dr. Glover.
Thank you. Thank you. All right, so now we're ready for item 6 on the agenda, which is our administrative reports and presentations. We have Mr. Rogers here to present the Fast Track Cities of Durham presentation.
Good evening, everyone. Are you all able to see my
Yes.
PowerPoint presentation?
Yes,
Wonderful.
yes, we are.
So good evening. I'm Randy Rogers, and I am the program coordinator for Fast Track Cities Durham. So before I go into some more details about Fast Track Cities regarding our update, I wanted to give you a background and some overview information regarding the history of Fast Track Cities. Fast Track Cities launched on World AIDS Day in 2014. It's a part of a global partnership between cities and municipalities around the world. And our core partners are the International Association of AIDS Providers, and that's our chief technical partner as well, the Joint United Nations Program on HIV and AIDS, as well as the United Nations Human Program, as well as the City of Paris. Since 2015, the network has had more than 200 cities and municipalities to join this great initiative, this global initiative. So Fast Track Cities has 3 aims that we are working towards achieving by 2030. The first aim is 95% of all individuals living with HIV will know their HIV status. The second is 95% of all individuals living with HIV are on continuous antiretroviral therapy. And then the third is 95% of all individuals living with HIV or lived experience on our, we're hoping that they will achieve viral suppression by 2030. And I want to make note of when the initiative first started, the global initiative first started, those aims were at 90%. And they decided last year to increase that effort in terms of ending the HIV from a global standpoint. So in addition to the 3 aims that I've mentioned, I think it's also important to note we seek to reduce the rate of new infections. And 2 of the ways in which we are actually doing that is using treatment as prevention, known as TAP, as well as PrEP, which is a prevention tool to prevent HIV pre-exposure prophylaxis. All Fast Track Cities share best practices as well as data and other resources on our Fast Track Cities dashboard. I've actually listed the links below, the hyperlinks below for our specific Fast Track Cities initiative germane to Durham, as well as our Facebook and Instagram accounts. So at your leisure, I would welcome the opportunity for you all to visit those social media platforms. So the Fast Track Cities Advisory Board is really the heart and soul, the infrastructure for facilitating Fast Track Cities' various activities. So Fast Track Cities Durham Advisory Group's overarching intentions are to inform, guide, shape, support, and evaluate the three core objectives aforementioned. And we do this with an interdisciplinary team. Some of our advisory board members are physicians. We have a disease intervention specialist. We have a mental health social worker. Her specialty is in mental health. And we have representation from NCCU. So we have a student, and we've just had an individual of lived experience, as well as a staff member at the LGBTQ Center of Durham to join our great advisory board as well. So three of our core activities with the advisory board is providing HIV prevention and treatment education, along with increasing accessible testing efforts in underserved communities, creating a social media presence to educate, evaluate awareness, as well as to combat HIV stigma, as well as promoting the benefits of PrEP and TAS, as I mentioned earlier. So where are we now? If you all will notice that our most recent data is from 2021. The state has been behind. There has been some remarkable delay in sharing the data from 2022. So what we do know is when we look at where we're standing from a global perspective, over 85% of persons living with HIV in Durham have been diagnosed. Of course, we don't necessarily have the data for those who are on ART, which is antiretroviral therapy, but we do know the number that is virally suppressed, which is 56%. And so if you look at the information that I have below that, you will see that the people who are living with HIV retained in care, that number is 60%. So you see that there is a direct correlation with those who are virally suppressed and those who are retained in care. And that's what we want to see. Of course, we still have a ways to go, but we are definitely making some strides in terms of trending in the right direction as it relates to the 95 target aims. So let's see here. Okay, so let me talk about some of our highlights and outcomes with Fast Track Cities to date. To date, I have had the pleasure of coordinating and facilitating 4 productive Fast Track City Durham Advisory Board meetings to date. The Fast Track Cities dashboard has been updated to include HIV data as well as HIV treatment and prevention resources. And you will see access to the dashboard later in my presentation. My intent was to take you all directly to the dashboard live. However, the national platform obviously is having some issues with the server, so it isn't available right now. I was invited to represent Durham as a panelist at the Fast Track Cities International Conference this past October. I had the privilege of curating the county-wide World AIDS Day 2022 virtual event, and we also received a proclamation from the city of Durham. This past April, I was also able to serve as a panelist. I was selected to serve as a panelist during the Durham National Dialogue on the intersection of racism and HIV as a public health crisis. And that was a pretty dynamic webinar. And what they've done is chosen, pardon me? what they did was selected cities, major cities across the United States and abroad to participate in these international as well as national conversations. I'm super excited about the launching of our social media engagement campaign that will be happening this summer. And the focus of that is just to bring greater awareness to Fast Track Cities Durham, as well as our goals to end HIV. So some of our deliverables to date, which are ongoing, consist of I manage the Fast Track Cities Durham social media accounts, which consist of Facebook and Instagram on a weekly basis. I provide community education with an emphasis on PrEP at community events. The most recent event I attended was this last Saturday at Healing with Care, and it was a health fair. What I really appreciated about this particular event, I had an opportunity to talk to older adults about PrEP, because what we know about human behavior, sex just doesn't stop during certain age intervals or cohorts. It's over a lifetime. So it was really a nice engagement, if you will, conversations that were had with some older women about the benefits of PrEP. I also provide talks at various meetings with a focus on HIV prevention and eliminating stigma. I also disseminate Fast Track Cities Durham and PrEP information at community establishments. And when I say community establishments, that's some of the popular restaurants. What I love about Durham is we are a city of several independently owned restaurants. So while there are chain restaurants that exist here, we have a strong presence of independent restaurants where a lot of our community members frequent, and there's a breadth of diversity in terms of the consumers that frequent there. And I've found it quite beneficial in terms of sharing information about PrEP as well as Fast Track Cities at various community establishments. And then I also serve on several HIV-centered advisory boards with the work that I'm doing. For an example, I participate with the UNC CFAR. I sit on the PrEP Advisory Task Group, as well as a work group that focuses on re-engagement with care at Duke. So some of our activities that remain in progress are increasing our community representation from populations most vulnerable to HIV acquisition regarding serving on the advisory board. So this has been a pretty arduous task, yet I remain very hopeful with identifying more community members, particularly, like I said, of lived experience or who are more vulnerable to HIV acquisition. And then increasing availability of PrEP access in underserved communities. I would be remiss if I didn't take the opportunity to give Durham County Department of Public Health a major shout out in terms of our efforts to make sure we are doing our part with eliminating one of the barriers as it relates to PrEP access. So now for individuals who enter our clinic, if they're interested in PrEP, we can actually get them started after the appropriate assessments. And although we don't have the funding at this point to continue those services with us, what we are ensuring is that those who want to continue with PrEP, that they are connected with other community resources so that there is a smooth transition. So whether that's with the Duke ID Clinic, whether that's with Lincoln or UNC. So globally and domestically, great strides are being made to end HIV. However, systemic racism and stigma continue to be pervasive barriers. And that's something that we are continuing to address. It's been a privilege over the past year to serve as an effective mouthpiece in various settings regarding addressing some of the systemic barriers that we are experiencing. With that being said, I don't ever want to minimize the strides that are being made, particularly as it relates to us being a Fast Track Cities partner. So thank you all for your attention and your time. Are there any questions?
Mr. Rogers, I did have a question. First, let me thank you for your presentation. I found it to be quite informative. In regards to the 3 objectives of 95%, can you explain a situation? In my mind, I'm thinking that once Fast Track Cities of Durham knows that a person is living with HIV, I would think that the person would know that first. So give me a situation where Fast Track Cities of Durham knows that a person is living with HIV, but the person is not aware of their status.
That's an excellent question. And so given the role that I am in, I would not necessarily know that. The disease intervention specialist or the HIV counselor who actually took the test and received the test results would make sure that that individual who tested positive would get those results. And so what the hope is, if a person tests positive, the individual who actually performed the testing would connect with them directly, or the disease intervention specialist would become involved with actually trying to get in contact with them. And that information is directly reported to the state, of course. So in my particular role, I work more with the systemic components of looking at the data being tracked, but I don't actually interface directly with our consumers or patients who are who are newly diagnosed. Is that helpful?
Yeah, so I can imagine that perhaps you might have or there might be a patient that comes in for testing, the results come back and they don't come back. So that might be a situation where Fast Track is aware of their status, but they aren't. So yeah,
absolutely.
I was just curious. Yeah, I was just curious as.
And you're correct,
because
the information would be captured from a tracking standpoint. However, it can be some challenges depending upon where that individual is. And you really are touching on something a little bit deeper, but this is, hopefully there'll be another time for us to discuss what some of those challenges and barriers are in terms of why individuals are not accessible or following up to receive their actual results. But that's another whole conversation. But I appreciate your question.
Yeah, absolutely. Thank you for your response as well.
Thank you.
Do we have any other questions for Mr. Rogers? All right. Well, thank you, sir. We appreciate it.
Thank you. Thank you. It was a pleasure.
Absolutely. All right. Well, that certainly is, again, good information. We're going to move on to our next presentation, which is going to be given on the topic of on-site septic system repair funding. And Mr. Patrick Eaton is here with us to give that presentation. So Mr. Eaton, you have the floor.
Thank you, Dr. McDougall. Give me one moment to share the screen and we'll get going.
Certainly.
Okay, and just a quick check. Does everyone have my presentation?
Yes, sir.
All right, wonderful. Okay. First off, I want to say thank you to the board for allowing me this opportunity. I want to talk to you all tonight about a sort of an idea that's been battered around in environmental health for quite some time. It certainly predates my tenure as supervisor, which has gone on about 12 years now, and Attorney Wardell can certainly speak to it as well. But I want to talk about a potential opportunity for a septic system assistance program for repairs. As you all receive the notice of violation report every month at your meeting, you know, we constantly have systems that are non-compliant. Many of these systems that fail in the county do not get a notice of violation. They're self-reported. They're taken care of in pretty short order by the system owners, and it doesn't escalate to the point of you know, legal assistance. But the goals of a potential assistance program would be of course, we're wanting to protect the public health and reduce contamination of ground and surface waters through systems that continue to fail, especially those long-term. We're looking for an opportunity to provide assistance to qualifying Durham County property owners for septic system repairs. We want to educate homeowners on proper maintenance of their wastewater systems to help prevent premature failures and try to get as much performance out of those systems as possible. And we want to establish pleasant and productive encounters with septic system owners, because anytime the process becomes adversarial, it's generally antithetical to collaboration. Public health concerns, they really start with the laws and the rules. As authorized agents of the state, environmental health specialists are entrusted to enforce the laws that govern on-site wastewater systems. And at a state level, any person who owns a place of public assembly, residence, business, or place of mass gathering is required to have an approved permitted wastewater system. That can be anything from a septic system to municipal sewer, and there's some other alternatives out there, but primarily we're talking about septic systems and sewer, and in the context of public health, it's going to be the on-site septic systems. The rules also allow the local health departments to enforce the rules and general statutes. And then, you know, our big concern again is that surfacing sewage does have a detrimental effect on public health and the environment. Just a brief overview of some of the repair issues that we face in Durham County, and it's certainly not unique to Durham, but we are a repair oriented program, which I'll demonstrate in a few minutes. When it comes to rule enforcement, especially when we have to pursue legal remedies, it is very costly for Durham County, both in terms of full-time equivalent work hours, actual cash when it comes to the filing fees for a legal action. We have issues where systems are failing and there are low property values, low household incomes, and they're not able financially to address their failing system. We have issues with seasonal failures due to the nature of the soil and the age of some of the systems. We'll see them fail during the wetter periods of the year, and they may function during the drier portions of the year. So it's often difficult to try to pursue legal enforcement when, you know, today I can say a system's failing, but 3 months from now it may not be. We have issues with legacy systems. That is, there is no designated repair area for the initial system that was constructed. That didn't come along in the rules until 1983. We have some small lot sizes. Again, you know, these are legacy issues. Unsuitable soils. We have a great portion of our county within the Triassic Basin that has clay mineralogy that's unsuitable, shallow water tables, issues like that. There's limited sewer availability in much of the county. And then there's also limited approval of NPDES permits. For those not familiar with that, those are permits under the Federal Clean Water Act issued by the state for discharge systems. Those are systems that pre-treat the septic tank effluent to a discharge standard that can then be applied to either the ground surface or surface waters. It's important to note that only the state can issue those permits. Local health departments can only issue permits for subsurface systems, and that is systems that apply septic tank effluent below natural grade or into approved fill. To give you just a quick overview of what the repair trends look like in Durham County, for the period 2015 to 2018, we issued 135 repair permits. 42% of those were exploratory digging, and that is generally a system that's experiencing a localized failure and is often due to items such as sludge buildup, root infiltration, perhaps even physical damage of the system. And those are oftentimes partial repairs that then place the original system back into service. 35% were tank replacements, that is, a tank is not watertight or is damaged or partially collapsed. And then 23% of those were drain field addition or complete replacement of the drain field. For those repairs, property tax values, approximately 10% of those properties were valued at less than $100,000 at the time. 35% were under 150,000, and then 60% were below 200,000. So many of these repairs are not done on highly valued tax parcels. Looking at the period 2020 through 2022, we had a 43% increase in repair permits issued compared to the previous 3-year period. What I found interesting, though, is that the splits between the types of permits were exactly the same to the percentage point when it came to exploratory digs, tank replacements, or drain field replacements. But again, we did see a 43% increase in the total number of repair permits issued. And, if that trend holds, we're just going to see more and more and more repairs and failures as we move along, which is not unexpected, given that there were a couple of, big building booms in the 1950s after World War II, and then again in the late 60s, early 70s. And those systems are just simply reaching, they're aging out, and they're losing their hydraulic conductivity. Where we get into some discussion about dollars and cents, and this is where I think it was helpful to show the tax values of the properties. Since I last gave a presentation like this in 2019, the average estimate for system repairs has nearly doubled since 2019. It has outpaced inflation quite a bit. But I contacted a few local companies that operate in Durham just to get some ballpark figures of what system repairs look like for a homeowner. And if we're just talking about a conventional or accepted type gravity septic system, if it needs a complete replacement, you're looking somewhere between $7,800 to $9,000, and that's just tank and drain field. That does not include site prep or tree removal or any other site modifications. So that's basically just the system and the labor. If you add a pump to a conventional system, that's going to be about an additional $5,000. If you have to import soil cover to place a system at grade and bring in a cap, you're looking at somewhere between another $8,000 to $10,000. So you could have an at grade pump conventional that's going to run you in the neighborhood of $20,000 to $25,000 just to replace the system. And if you're looking at a house that has a value of less than $100K, that's a really tough pill to swallow. If the site conditions are extremely limited, your only options may be surface drip irrigation or pre-treated drip irrigation, and it takes specialized installers to put those in, and those are going to range anywhere between about $35,000 to $50,000 just for the installation, and then that's followed up with probably close to $1,500 a year in operation and maintenance costs. So it's a very pricey option that, unfortunately, due to many of our site and soil conditions, is going to be a increasingly popular one. Oh, pardon me. Here's just a couple of GIS maps we put together. It kind of shows you the distribution of repairs in Durham County. Clearly, you don't see too many within the heart of the city because that's on public service. but you'll see they're concentrated in the 277, 12, 03, and 04 zip codes, which of course have the lowest sewer infrastructure. And then you can see some parcels on the right with the red dots. Those are repairs that occurred on property values that were under $150,000. Our records estimate, we can confirm absolutely we have over 3,000 systems that are over 30 years old, and they're going to continue to start to show malfunction. So, as stated with the emerging issues there, we're going to see increased septic system failure just as a matter of age of these systems. Residents with low income, low property values may not qualify for home equity or even personal loans to address the repairs. When we have to pursue legal remedy, the wastewater continues to pollute because we do not have a citation authority as environmental health specialists. We pursue civil remedy. The inability to afford repairs, unfortunately, can and has in the past resulted in a court-ordered eviction and displacement of residents, which is something we all find not very palatable. It's certainly not something we're out to do. Our goal is compliance and not punishment. So there are a few local initiatives that I wanted to go over. The city of Durham implemented a program called Septic to Sewer, where cost share assistance is available to help qualifying homeowners connect to public sewer within the specific Northeast Creek watershed. And our neighbors to the north in Person County have a local septic system repair grant program that provides financial assistance to qualifying property owners. The Septic to Sewer program in the city was funded in 2021. The city appropriated $100,000 to address total coliform pollution in the Northeast Creek watershed. And the goal is to promote connection to sewer for aging or failing septic systems within that watershed. The program is funded through 2026 or until the funds are depleted. The eligibility requirements are vetted by the Durham County Department of Social Services. And as of the end of May of this year, 11 applicants have been approved for a total of just under $20,000 in cost share funds. Person County has a local grant program for septic system assistance. This data is a little bit old. I was not able to get a updated report from them in time for the meeting, but as last I knew it, they provide up to $4,000 in assistance. They fund it via a county stormwater utility fee, a portion of that. To be eligible, you must be a resident of the county and own your own home. Eligibility is based on a sliding fee schedule similar to that used by other health departments for clinical services. And approved applicants may receive grants ranging from 20 to 100% of the repair costs up to the maximum of $4,000. An applicant is eligible if the annual gross family income is below 350% of the federal poverty level. Their procedure is that the homeowner requests and obtains a repair permit from the health department. They obtain at least 3 bids from certified wastewater installers, and then they submit a completed grant application form with the required documentation and contractor estimates. Approved grant funds are paid directly to the contractor, and the septic contractor submits an invoice to the county for their portion that's going to be covered under the grant. And then the invoice is forwarded to county finance, which in turn issues the check. The last data I had as of 2017, you can see the annual totals from 14, 15, 16, and 17, the number of repairs that were qualified, and then the total repair costs versus the amount of coverage that was provided by the county. So unfortunately, I wasn't able to get more recent numbers, but you can see that it's been somewhere in the neighborhood of about $35,000 that was granted in those 4 years to help out homeowners. We would like to propose a program in Durham to establish something similar to that. We would suggest setting the grant limit at $10,000 due to the high cost of repairs in Durham, also our limited site conditions that often require the permitting of more expensive systems. We're looking at potential initial seed money from new initiative budget requests, cost share funds, and other avenues that we can explore. We would look for possibly an annual renewal of around 25,000, depending on how well the program is utilized. We could also look at potentially upping our permit fees to help offset some of that. In our program, we obtain fees from improvement permits and construction authorizations for new construction, structural alteration visits, reinspection fees, and swimming pool permits. So just in conclusion, the city of Durham and Person County have seen some success after implementing assistance programs to help address failing septic systems. Durham, without a doubt, will continue to see more complex septic repairs and higher numbers of repairs overall, just due to the age of our systems and our limited space and soil characteristics. And Durham may very well benefit from a similar program to Persons, to help potentially avoid some of our legal remedies. So with that, I'm happy to take any questions, and certainly I would invite any commentary from Attorney Wardell, since he's on the leading edge of many of these issues.
Thanks, Pat. We talk about this every month. We fight the fight in the trenches, and once it gets to me, that means that there's a serious problem. But we have been talking about this for the last 12 years, at least. I think now is an opportune time to try and get funding for it. There may be some space for some ARPA funds. There may be the availability of some other COVID-related funds that you're allowed to use for infrastructure programs. But it seems like now is a really good time, an opportune time to try and get some funding for this program. The problem's not going away. It is cyclical, and it seems to come in waves. So the houses getting older, and as they get older, the systems are going to fail. So I think now is a good time to try and get funding for this. I think there are examples of how to do it in a way that's both cost effective and results oriented. And we just need to get the support from the health department as a whole, and from the commissioners to make it happen.
I had a question, if no one else has one. Mr. Eaton, could you speak to us a little bit about I get that we've got some, I'm guessing, rural areas. You mentioned 3 area codes, I think 12, 03, and 04,
Yes.
where most of the septic issues are present. And I'm assuming at this point in time, we have sewer lines in those areas as well. What's the average range of cost to transition from septic to sewer, and as it compares to average repair costs?
Sure. So I'll start with in 27712, 03, and 04, there's very limited sewer infrastructure.
Gotcha.
It's almost entirely on-site wastewater and well both. There's some overlap. There's a little bit here and there, but by and large, in those 3 zip codes, sewer is not an option. But for those areas that do have it, and we do see several, especially if it's a system where people didn't even know they had a septic system until something went wrong and sewer is available. Last I heard, and please don't quote me, but on an exact number, but I think the city's tap fee is somewhere in the neighborhood of around $5,000 to $6,000 these days. And then it's whatever it costs for a plumber to install the lateral from the house. And that's going to range anywhere from, a few thousand to a lot more, depending on whether or not that's a gravity line or if it's an ejector pump. So I think it runs sort of parallel to wastewater systems in that you're looking at probably in the neighborhood of 8 to 10,000 to install a sewer connection. And of course, it goes up from there based on complexity.
Gotcha. Thank you.
Yes, sir.
Dr. McDougall, this is Chris. Can I say something or have
Absolutely,
Patrick
absolutely.
expand on some things? Yeah, I think it's very relevant to this discussion that I'm going to go ahead and ask Patrick. I want you to expand on how many systems do we have in Durham, and this is a rough number, and how old they are, and what's the average life expectancy of a system in North Carolina.
Sure.
And an impediment to getting repairs done. How far out are installers today on new systems, and what's their incentive to repair a system versus install a new one?
Sure. So I'll try to catch all those points. So let's start with, we estimate there are approximately 12 to 14,000 septic systems in Durham County. We know for an absolute fact, almost 3,100 of those that are confirmed and identified are over 30 years old. There are certainly more than that. The average wastewater system life expectancy in Durham is right around 31 years. The last time I crunched the numbers, the statewide average, the last I heard, was less than 15. So, thankfully we're not in that boat. Generally speaking, as an industry standard, 20 to 30 years is a reasonable expectation for lifespan on a drain field. And, like I said, we're seeing our neighborhoods that were built out in the 50s, 60s, 70s, 80s, and even now we're starting to see systems from the 90s that are starting to show their age. So we have thousands that are coming our way, no doubt. I have heard from some installers, their scheduling is as far out as 14 months for new jobs. So, I don't want to give the false impression that if we had a pot of money that it's going to, affect immediate fixes. There's, other factors at play. Some installers, especially during building booms, they don't even want to deal with repairs. They would rather just install new construction. So, there are challenges there just with scheduling and contractor buy-in. But, another thing that helps, at least in the Person County, when last I spoke to those folks, were, the contractor is a little more apt to want to repair a failing system if they know there's some guaranteed funds. They're going to see a paycheck at the end of the day, and certainly the county's good for their end. So, that's helpful as well. And Chris, what else did I miss? Anything else?
I think you got it.
Okay.
Thank you.
Chris and Patrick, do you know if the city has any plans for extending the sewer infrastructure into those 3 zip codes where there's very limited infrastructure at this point in time with the way the city is growing?
My understanding is that they do not, because it requires annexation, and that is its own whole nother, ball of wax. And you often find great resistance within the community to being annexed. So no, I do not foresee public infrastructure anytime expanding into these heavily septic dense areas.
Okay, thank you.
Yes, sir.
All right, well, that's great information. Does anyone else have any questions?
I just want to say thank you. That really was a really good presentation and very good information.
You're very
welcome. I used to live in a county with a septic system.
Agreed. Thank you.
Mr. Chair, I'll just say, for brevity's sake, I will say that Chris Salter approached me with this plan some time ago, pre-COVID. Then, of course, COVID came and just robbed all our minds of it. Attorney Wardell is correct. There are still ARPA funds available. At the time when we had interim county manager Claudia Hager, I did talk to her about this and just kind of really made the pitch when those ARPA funds were coming into fruition. I think it's time for me to have a new conversation with our current county manager, Dr. Kim Sowell, just to let her know that I think this is a good thing and this is something that's going to help our citizenry.
Sure enough. Yeah. Thank you. Well, thank you again for the presentation. Again, very, very, very informative. And thank you for all the hard work that you continue to do to support our citizens that have those septic issues. So, all right. Well, we're going to move on to item number 7 on our agenda, where we have our public health vacancy report. Director Jenkins, I'll let you have the floor to talk about these things.
I'll be really brief. I've been very proud of the leadership team and our management team as a whole in the work that they've done to recruit new talent. We still have our issues when it comes to nursing, but divisions like environmental health, knock on wood, and a couple of others, we're starting to see a lot more people coming on. That's indicative of state of the economy and things, how things are going with the workforce. So we've been pleasantly surprised to see the number of new hires that we have coming on. But make no mistake about it, our Board of Health, we still got a ways to go when it comes to nursing. I think I told Dr. McDougall even privately when he came and paid us a visit, it's not just us. When we say there's a global nursing-wide shortage, even across the pond in London, they pretty much said that, you know, they are having a hard time recruiting nurses, and they have a national healthcare system that, you know, everything's paid for. And they pay for the education for their docs and their nurses if they come to work for the NHS. So, you know, it's a constant battle, but we're in it for the long haul.
All right. Thank you. Thank you. And we have our NOV report. We just had the presentation from Patrick, but does anyone have any comments regarding our NOV report? All right. All right. We're going to move on then to our health director's report. Director Jenkins, I'm going to give you the floor again to discuss your report and
Thank you, Mr. Chair.
answer any questions.
Thank you, Mr. Chair. Just again, want to thank the board for hanging in there. I know we had two presentations, but not much to report. Just really want to bring your attention to Population Health Division. We look forward to them possibly presenting the youth-based risk behavior survey. That's something that we tend to do. Of course, with so much violence going on with our youth, it'd be interesting to see that data that came out of COVID and see how our youth responded to it. So again, I just wanted to mention that to you. And of course, our dying team continues to be phenomenal, doing very innovative things with nutrition. And it's no surprise there that they had a good report for you all. So that's pretty much all I have, Mr. Chair.
Very good. Very good. I was reading through the dying report and just had a quick question. What sort of edible plants are the young people growing in these garden kits? Tomatoes, herbs? I mean, what sort of things are?
We will allow Rachel to expound on that.
Yes, both of those things actually.
Okay.
They do often start with herbs because they're small and easy to see quick results. But tomatoes also, they do grow. Both of those, herbs and tomatoes, are the primary things.
Oh, okay. All right.
Yeah, you guessed it.
Good guess.
Yeah.
I don't have a green thumb, so it was really a good guess for me.
Yeah, they're easy they're easy to start in small little containers, and yeah.
Okay, thank you. Very good. Very good.
You're welcome.
All righty, we're moving on through this agenda. We don't have any committee reports today, and it doesn't look like we have any old business. We do have a couple of items for new business, and we have our draft resolution for school meals for all. Director Jenkins, do you want to take that or?
Happy to expound on that, Mr. Chair, and I'll be
Yeah.
very quick. Our nutrition division, in partnership with our cooperative extension, would like this board to consider support of this campaign to provide school meals for all of Durham Public Schools students. They certainly feel that providing school meals to all students would benefit, not only the students, but also the families. As Rachel can attest, they do get a lot of positive feedback from the food demonstrations and all the education that they provide. But this would be one additional step to ensure that nutritious meals are served. I do believe that the Board of County Commissioners previously had approved a resolution maybe several months ago, and we thought it fitting for this board to really weigh in. This resolution, if approved, would actually be sent directly to the General Assembly for considerations for the state biennial budget.
All right. Well, I will entertain a motion to approve the resolution for school meals for all. If there's no debate at this time or no questions.
So moved.
All right.
Second.
A motion. All right, a motion that's been seconded. If there's no debate, we are ready for the question, Ms. McLean.
Dr. McDougall,
Yes.
Commissioner Alon, Dr. Jackson,
Yes.
Yes.
Dr. Miller,
Yes.
Dr. Braithwaite,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
and Dr. Glover.
Yes.
Thank you.
Thank you. All right, so I guess that will go on to the county commissioners and hopefully to the assembly and be approved. So do we have any agenda items for our next meeting, which will be our August meeting, if I'm not mistaken? Is that correct,
That is
Rosalind?
correct. We're hopeful that this great board enjoys a little respite for the month of July. For the month of August, we are looking forward to presenting to you from our population health division, the state of the county health report, and also our county health rankings report. So those are the two things that we have for your consideration for the August meeting.
All right, very good. Anything else? All right. So we'll move on to our informal discussion. I wanted to start by just saying how pleased I am to speak on behalf of the board. Last month, under the leadership of our vice chair and our chair of personnel committee, we were able to review the performance evaluation of our Director Jenkins, and unanimously voted to make the recommendation for an exceeds expectations ranking for our director to go forward to the county manager. So I wanted to just publicly say that, to give him recognition and have that go on record, and thumbs up and kudos, and continue to do good work for this board, for this health department. Sorry.
I'd like to publicly thank this great board. It's been an honor and a privilege to continue to be the health director here. Glad I got another 365 ahead of me, and we appreciate the vote of confidence.
Yes, sir. All right. Any other discussion? All right, you folks, you look like you're ready for the weekend to start. So I will entertain a motion for adjournment. Maybe not. Maybe not.
So
ready.
moved.
Second.
Okay. It's been moved and properly seconded. Rosalind, we're ready for the vote.
Dr. McDougall,
Yes.
Commissioner Alon,
Yes.
Dr. Jackson,
Yes.
Dr. Miller,
Yes.
Dr. Braithwaite,
Yes.
Mr. Brown,
Yes.
Mr. Gregorio,
Yes.
and Dr. Glover.
Yes.
Thank you.
All right. Well, thank you everyone for coming on today, and thanks for the presentations and the discussion. I hope everyone has an enjoyable summer. We'll see you again in August.
Thank y'all very